Hey, it's Roberto Miki again. We've got another great hand question of the week. It's number 34 in our series of questions for medical students, residents, and fellows studying for the boards or in-training exams. Well, let's get right into it. It's an amyloidosis question. Which finding is not a musculoskeletal manifestation of amyloidosis? A, carpal tunnel syndrome. B, trigger finger. C, lumbar spinal stenosis. D, spontaneous distal biceps rupture. Or E, tibial stress fracture. Well, here's your chance to pause the video so you can think about the question and answer it. Amyloidosis is a systemic disease characterized by deposition of abnormally folded proteins in tissues causing disease. The main problem with amyloidosis is cardiac failure, but some musculoskeletal manifestations occur before the cardiac failure. So, in a 2018 study at the Cleveland Clinic in Cleveland, they showed that 10% of the patients undergoing carpal tunnel release had a positive biopsy for amyloidosis. So carpal tunnel syndrome, lumbar spinal stenosis, trigger finger, spontaneous distal biceps rupture, lumbar stenosis, and rotator cuff disease are common manifestations of amyloidosis in the musculoskeletal system. So treatment for amyloidosis is now available, and screening by surgeons may be a benefit in recognizing these patients prior to them having cardiac problems. So we may play a key role in helping this disease become less problematic. A study by Sperry out of the Cleveland Clinic demonstrated that 10% finding, and I recommend that you read it. It's a really good one. And Zhang in the Journal of the American Academy of Orthopedic Surgeons discusses the orthopedic manifestations of amyloidosis, which I think is also a good article to review. So the answer to our question is E, tibial stress fracture. So tibial stress fractures are not associated with amyloidosis. I hope you enjoyed the video, hope you learned something, and we'll see you at the next one. Remember to like and subscribe so you can continue to support this channel.